So for our providers in the state that are hearing this and listening to this, particularly say members of the Utah Medical Association, the largest physician group within the state, many of them are non-BIPOC providers. What do you think is the biggest thing that they can take from this, they should take back to their practice or their health system? Because all of us went into medicine because we want to ease suffering, increase length of span of life, and decrease pain for people.
Right.
What can a non-BIPOC provider do if, because many times it's not, and I'll get to this later, not every Black patient will have the opportunity to see you, Ashley,
Right.
And Dr. Decimo.
Right. I always say that one of my biggest worries is that people don't believe that they're contributing to this problem. The statistics show that people are contributing to this problem, whether they think they're racist or not, whether they think they have these biases or not. Just, we're all human. So just look within. I think we all need to look within. I need to look within. And so just take a look at ourselves and make sure that we're providing equal care to everyone.
Yeah, and I think it requires just a reorientation in terms of which patient populations you may be taking care of, in terms of reorienting your perspective. Mm-hmm. I think that, as a medical community, we've done a good job in terms of trying to take care of the opioid epidemic, and I think there's been a great push to try and provide those patients with resources. And I think if you apply the same principles to what's statistically proven to be a very high-risk population in terms of minority women, I think just having that perspective in the back of your mind, if you happen to be caring for women of minority backgrounds, can possibly influence outcomes. So I think that reorientation is important. And I also think that it's important for providers to be able to have those types of conversations with their patients, so that patients know that their providers are aware of these statistics and the fact that a certain patient may be high risk. And it's important for patients to know that, so that they're not discouraged with the healthcare system or with their individual healthcare providers. I think trying to establish a very open-ended, kind of dialoguing, team-centered approach between healthcare providers and patients may also help the situation.